While walking home from the train station, M.A., a 72-year-old woman with osteoporosis, tripped over a broken curb and fell. In the emergency department, she was assessed for severe pain, swelling, and bruising of her left thigh. A radiograph showed a displaced left femoral neck fracture. M.A. was prepared for surgery and given a preoperative injection of an analgesic to relieve her pain. Intraoperatively, she was given a spinal anesthesia and positioned on an operating room table, with her left hip elevated on a small pillow. Intravenous antibiotics were given before the incision. Her left hip in abduction, blood and fluid replacement. Physical therapy and vigilance for development of avascular necrosis and possible dislocation. AR, age 88, slipped on the wet grass and fell while gardening in his backyard. His neighbor was unable to help him to a standing position and called for an ambulance. AR had excruciating pain in his right leg, which was externally rotated, slightly shorter than his left leg, and adducted. Preoperative radiographs showed a non-displaced right intertrochanteric fracture. Intraoperatively, Mr. R was given spinal anesthesia and positioned on an orthopedic table with his right hip abducted and secured in traction. He had an open reduction and internal fixation with a compression screw and side plate with screws. His postoperative recovery was unremarkable, although he was at risk for deep vein thrombosis, that is, blood clots in his legs. He was discharged to a rehabilitation facility for several weeks of physical therapy and assistance with activities of daily living, such as personal hygiene, dressing, eating, ambulating, and toileting. Number 1, replacement of half the joint component is a hemiarthroplasty. Number 2, substances that act against microorganisms are antibiotics. Number 3, in a position away from the midline of the body is abduction. Number 4, position toward the midline of the body is adduction. Number 5, displace and dislocate. The prefix is dis, and the meaning of the prefix is not or away. 6 is replacement or rehabilitation. The prefix is re, and the meaning of the prefix is back or again. 7 is avascular. The prefix is a, the meaning is not or without. 8 is anesthesia or analgesic. The prefix is an, and the meaning is not or without. 9 is orthopedic. The prefix is ortho, and the meaning it means straight. 10 is externally. The prefix is ex, and the meaning is away from. 11 is bipolar. The prefix is bi, and the meaning is to. 12 is unremarkable. The prefix is un, and the meaning is not. And the fill in the blank. Number 13, the adjective for the operative time span from decision for surgery to placement on the operating room table is preoperative. 14, the adjective for operative time span from placement on the operating room table until transfer to post-anesthesia recovery unit or ICU is intraoperative. And 15, the adjective for the operative time span for admission to post-anesthesia is post-operative.